What's the difference between eyelid ptosis and hollow upper eyelids?
Eyelid ptosis, or drooping upper eyelids, is a condition that may be present since birth, after an injury directly to the eye, or from neurologic causes, and is commonly associated with aging, as the muscle responsible for elevating the eyelid, called the levator muscle, stretches or detaches from its normal insertion. Eyelid ptosis is oftentimes overlooked by surgeons who are focused on performing typical routine upper eyelid blepharoplasty or eyelid surgery. This can result in dissatisfaction after skin and fat is removed, and you still look tired afterwards. Interestingly, hollowness in the upper eyelids can also look like you have a drooping eyelid. While the appearance of hollowness and eyelid ptosis can look similar, the treatment for these conditions are very different. I'll discuss how I diagnose and treat eyelid ptosis and hollow upper eyelids in my practice. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery, and I'm a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I perform a wide range of cosmetic eyelid surgery, such as treating hooded upper eyelids, puffy under-eye bags, and Asian eyelid surgery. I also perform specialized eyelid surgeries generally not performed by general plastic surgeons, such as eyelid ptosis correction and revision eyelid surgery originally performed by other surgeons. I'm also known for non-surgical eyelid procedures, such as the placement of injectable fillers in the upper and lower eyelids to improve the appearance of hollowing, as well as advanced laser procedures for the improvement of skin quality. As I mentioned earlier, eyelid ptosis and upper eyelid hollowing can appear to look similar, and you can have both issues at the same time. Let's begin by understanding eyelid ptosis. Eyelid ptosis can be due to a detached, stretched, weakened, or defective muscle that lifts the upper eyelid, called the levator muscle. Levator is like the word elevator without the letter E. Hollowness in the upper eyelid isn't related to the levator muscle, but rather is due to factors such as the absence of fat in the area directly below the brow, as well as bone loss from aging. It can also be the result of fat removal performed during cosmetic upper eyelid surgery. This is an important concept. The art of cosmetic eyelid surgery begins with an understanding of the natural character of your eyes. People who've always had hooded eyes generally don't want too much of their upper eyelids showing after surgery. Many of my male patients want to see the shape of their eyes, but not too much of the eyelid. This means that eyelid surgery is not a generic procedure which all surgeons perform in the same manner, but rather eyelid surgery is an art where the patient's intrinsic character is preserved and the surgeon is technically able to achieve the desired outcome. If I suspect the presence of eyelid ptosis, I'll perform a ptosis examination to look at the position of the eyelid margin relative to the pupil, as well as the function of the levator muscle. If eyelid ptosis is present, different types of ptosis surgery are considered. Ptosis correction surgery can involve shortening or reattaching the levator muscle. The procedure is called a levator resection. When there is little to no levator muscle function, the eyelids can be elevated by the muscle that lifts the forehead, called the frontalis muscle, using a procedure called a frontalis sling. Mild degrees of eyelid ptosis cases can be treated from behind the upper eyelid to shorten a muscle called Mueller's muscle in a procedure called Mueller's muscle resection. I often combine this procedure with cosmetic eyelid surgery. This procedure doesn't usually add to the recovery time, which for most patients after cosmetic eyelid surgery is about 1 week. I used to perform surgery such as fat grafting for hollow upper eyelids. This was during a time before the introduction of hyaluronic acid fillers. I'd perform liposuction to harvest fat and then place the fat into the area where it was needed. We accepted that 30 to 70% of the fat would not survive and that the additional procedures would be necessary. Further, there are complications such as lumpiness and irregularities requiring surgical revision. The advantage of long-term permanent benefits are offset by the reality that bone and other age-related changes would continue, making nothing we do truly permanent. My current practice is to use hyaluronic acid filler. I perform these procedures using cannulas instead of needles in my exam rooms with little to no downtime. My patient is able to see the improvement immediately. Follow-ups are typically done in 2 weeks, and I really appreciate the safety and predictability of hyaluronic acid fillers for the treatment of upper eyelid hollowness. I also like having the option to use hyaluronidase to dissolve the filler if there is an indication, making the procedure to a degree reversible. Experience and expertise matters in any field of medicine. Patients often ask doctors questions like, "Have you taken care of people with my condition before?" Or, "How many of these procedures have you done?" As a cosmetic oculofacial plastic surgeon for more than 25 years, my familiarity and experience has helped my patients address their aesthetic concerns for their eyes at a high level reflective of the needs of people in the modern era of medical specialization. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our website or call our offices to schedule a consultation. Thank you.